to go ahead and check in via the chat. If you could, per usual, just kind of sharing your name, your school or organization, and where you're located. Let us know, are you coming from the city? Are you upstate? It's always kind of fun to hear where folks are plugging in from. And again, welcome to folks who are just logging in. Good morning and happy Thursday. Welcome everyone. I'm seeing, oh, Staten Island, Washington State, the Bronx, amazing. Representing Dream. So nice to connect with all of you. Again, my name is Stephanie and I'm a social worker and our director of clinical services at the leadership program. So a lot of the work that I'm doing is directly supporting young people and staff and school communities who've been impacted by traumatic and adverse events. And so we're really excited to have you with us this morning. We're just welcoming everyone into this space. This is also a repeat of this same workshop that I was able to do so wonderfully. Just meaning there's such great participation in December. So I'm very happy to be invited to go ahead and share this content yet again here in the new year in 2021. And we do have a poll for everyone. We're really thinking about today, trauma, which is a heavy topic, right? And so with that, we'd love to ask, what are you all doing for yourself right now? Whether it's to relax, to participate in self-care. So we have a quick poll. We'd love to get some of your thoughts and ideas. So we invite you, no pressure, but we'd love to hear, what are you all doing right now to kind of guard your joy in your happiness and be able to really thrive in your workflow while you're balancing many other things, many other roles in your life. We have about, wow, 17 of 29 folks with us. Lots of participation. Thanks, everyone. I hope the morning has been going well. If you're on the East Coast, or how you're doing, hopefully well. If you're plugging in from other time zones with us today. I'm seeing a lot of reading is happening, 50%. Art and music, 42% of everyone participating in that outlet, that release. Meditation is also really high, 38%. Some yoga. Yeah, everyone is really, it looks like finding different ways to really honor yourself in this work. I know I'm thinking a lot about self-care with my staff and also collective care. Right? How are we tending to one another? How are we really nurturing each other as we engage in the work that we're doing, which is really student-facing, staff-facing, and really people work. Maybe we'll give folks another few seconds to respond, and then we'll go ahead and move forward. And if there's other things that y'all are doing, please feel free to share those in the chat box too, if they're not listed here in our preset responses.
I ended the poll, so I just wanted to share the results with everyone.
Thanks, Danny.
So it looks like reading came out on top.
Yeah, 50%, amazing. You know, for me too, I'm trying to get into podcasts a little bit more. I am working from home with my 5-year-old. So I have my tiny coworker over here, and sometimes reading is hard because we're doing remote school, remote work. So sometimes I can plug into a podcast with my headphones on a little bit easier and not disrupt him, you know, from whatever he's doing. So again, thanks everyone and welcome. Again, our focus for this morning, we have a lot of great content, and per usual in these workshops, not enough time, but we're going to do our very best to make sure we can get all of you what the information that we've been kind of collecting and excited to share delivered. And then we'll also be sending out the slides to all of you. So don't feel pressure to kind of like write everything down. There's also some really important videos. So all of that will be sent to you. But again, we are going to be really centering our frameworks and kind of revisiting what many of us are already familiar with, kind of a recap of trauma-informed care, and then shifting into a newer framework, healing-centered engagement, again, really centering this text here from Dr. Sean Ginwright. And I know a lot of work that you all are doing is really grounded in these frameworks already, but maybe we haven't thought about this name quite yet, or perhaps you're already really familiar with this work, and you can share and give us some of your wisdom and expertise as pertains to healing-centered engagement, which really takes healing out of just the clinical work and provides more of a social justice lens and more of a political lens on healing. So it's a really, I think, pertinent topic with everything that is currently happening within society. So we look forward to more discussion with all of you. Our essential question for this morning, again, is how can we as stakeholders really expand our work from a model which often views trauma kind of as an isolated experience to more of an engagement model which supports collective well-being? And our hope is that we'll kind of dive into trauma-informed principles, again, recapping a lot of what I know this group is really familiar with, hopefully increasing our awareness around some of those different types of trauma responses in young people, and again, expanding our framework from trauma-informed care to also include healing-centered engagement. And I have a few quotes here to kind of ground us. The first on the left comes from Peter Levine. And Peter shares this with us, that trauma is perhaps the most avoided, ignored, belittled, denied, misunderstood, and untreated cause of human suffering. Peter has written many, many books in the field of trauma, so that might be a great author to kind of check out if you're looking for more resources, as well as the author on the right, Stephen Porges, who shares that trauma compromises our ability to engage with others by replacing patterns of connection with patterns of protection. This is something that I've seen a lot in my work in schools and in hospitals, always with adolescents and young people. That sense of maybe self-preservation where folks are kind of pulling back and working to have self-protection whenever they have perhaps experienced traumatic events. So I welcome comments or reactions in the chat box always, but for sake of time, we'll keep moving forward here. And as an important reminder, discussing adversity and trauma can be really difficult, certainly very challenging. And so I'm just inviting all of us to take good care of ourselves as we have really different backgrounds and individual identities and experiences that are kind of the backdrop to this conversation. So please take the best care of yourself as we, again, really dig into and unpack our topic today. A little bit of our roadmap where we're going to go in the next hour and 5 minutes. We're going to review our knowledge of ACEs and trauma. ACEs, again, are adverse childhood experiences. We're going to think about their implications on social and emotional learning and behaviors. And then also identifying the opportunity. What is really promising is that there's a lot of research on positive childhood experiences that kind of mitigates the ACEs. So how can we in our school settings and within our organization support young people who've experienced toxic stress, adversity, and perhaps traumatic events? And then lastly, we're going to be thinking about expanding our practice. Right? What's working well? And then where are there areas for expansion or furthering in the work that we're already doing to support young people and also our staff? So just to go ahead and start, there's, I'm sure, a lot of wisdom and knowledge within this group already. We'd love just to read, or if you'd want to come on and speak as well, always awesome. But what does the phrase trauma-informed care or trauma-informed practices, what does that mean to you? Or what kind of comes up for you in your mind or in your heart when you hear that phrase? So we invite you to maybe type some of your responses in the chat box. know it's a phrase that gets thrown around quite often these days, right? And all of us maybe have different associations and different meanings that we connect to it. I know it's quite early still, and it takes a while to kind of type our responses, so no worries, but I do see a few things coming in there. Thanks, everyone. Lauren showing responding to child behavior with keeping in mind possible previous trauma, right? Thinking about how trauma influences behavior. Mariah dealing with kids that had losses due to COVID. Thank you for that. Right, it's like things that we're really living through so intensely right now. Joanna, thank you. A clinical/person-centered focus that is performed through a lens of potential trauma one may have experienced. Yes. Latanya, how to empathize with the child, right? Keeping in mind it is not what is wrong with you, but what's happened to you. That's such a beautiful framework and reframe for many of us, right? That more strengths-based approach. Mariah bringing mindfulness of how to approach our children and our youth, right? And Chantel, thank you. I think of care of self and community, acknowledging the healing work that is really necessary for a better future. I couldn't agree more. And knowing that child behavior is almost never about what's in the moment, but what has passed. That's right. So their behaviors and our behaviors as adults too are always communicating something. And here we are, it's almost kind of like detectives, like what's going on with this person? How can I support them? So we're gonna go ahead now and share our first video. My amazing colleague, Danny, is gonna go ahead and share that video with all of you. I was having some sound issues with my computer, so forgive me as we toggle between screens, but I'm gonna go ahead and stop my share and allow Danny to show us this really amazing video from Turnaround for Children.
Awesome. I'm going to click the video, just let me I can't hear it, okay?
People feel that we're talking about just a small percentage of kids. But the fact is, trauma is much more ubiquitous than any of us know. And certainly we have been in many schools in high poverty communities where the children exposed to trauma is greater than 50%. I began by working as a child psychiatrist with kids who had known trauma. They came to my office often complaining about the same things. Certainly trouble in school, distractibility, impulsivity, sometimes aggressivity, and a lot of trouble trusting and having good relationships with kids or with adults. Adversity doesn't just happen to children. It happens inside their brains and bodies through the biologic mechanism of stress. Children under stress will have release of the hormone cortisol, and cortisol has effects on the learning center of the brain, which is the limbic system. At the same time, if children have a buffering relationship and the release of the hormone oxytocin, this will oppose many of the negative effects of cortisol and result in some of the resilience that we see and a normalization of brain architecture. If we're going to design schools that develop a learner who can learn anything, then that school needs to be designed for children who will come to school at different starting points. Stress and trauma cause uneven development of certain kinds of critical skills and mindsets that kids need for learning. So if we design those into a school environment so that things like self-regulation and executive function and growth mindset are things that we can actually build, then in effect, we've created schools that'll have the physical and emotional safety, the sense of belonging, the relationships, and the intentional development of the skills and mindsets associated with learning. The story in developmental science is an optimistic one, and it rests on the fundamental property of the brain that is its malleability. Negative things in children's lives can certainly do harm, but positive things can restore children to a healthy developmental path. More importantly, if we provide integrated developmental experiences for children in schools, we will not only enable them to recover from the effects of trauma, we will unleash the potential that exists in every single child.
For some reason, it's not letting me end the share.
Okay. No worries. Let me go ahead. I think I can do it from this end.
Okay.
Let me go ahead. Did that work? Are we back?
Yeah.
Okay.
Back.
Look at this. We're figuring it out, everyone. Thank you for bearing with us as we're toggling between screens. But I love that video. I think that it's such an important reminder about the power that we all have, despite the title or the role that we play within our organization. So we would love to hear a little bit, just briefly, on what you all think might be that optimistic story that science tells us about children, right, who've experienced adversity or trauma, thinking about what we are hearing there about the power of relationship. So we just welcome any thoughts or comments about the video in the chat box. Yes. Chantal, thank you. Right, young people are so resilient, often becoming community leaders. Absolutely. I know I learned so much from young people, such a humbling experience to work with youth. You know, I think they teach us so much each and every day. And I think that we all, again, it's that optimistic, I think hopeful story that we as educators, program managers, directors, you name it, right? That all of us have the ability to impact the trajectory of a young person's life through positive relationships, and seeing how that impacts stress levels and how that really works to kind of soothe that trauma response that so many of our young people have experienced. And even for those who have not, this approach, right, and how we cultivate our relationships with young people is helpful for everyone, right, no matter their history. So I have for us just a few brief overview of key terms. I know a lot of us have heard some of these before, but I want to go ahead and just kind of ground us in these three different concepts. The first being ACEs, which again is adverse childhood experiences. These are potentially traumatic events that children ages 0 to 17 either experience or perhaps witness. And then we have toxic stress, which is defined as repeated and kind of chronic exposure to some of the ACEs over time, and often without the support of other protective factors, such as relationships with caring and consistent adults in their lives. So that can kind of maintain the body's stress response into overdrive. And then lastly, we have trauma, which is defined as an experience of an actual, perceived, or threatened negative event, or a series of events that can cause emotional pain and a sense of feeling overwhelmed. And what's really important to note is that individuals, right, like us and also children, we all respond so differently to different events. So it's really one's perception, psychological reaction, and also the physiological reaction to the event that can determine whether an experience is kind of falling into that toxic stress category or that definition of trauma. And I'll share, as a social worker, working in family therapy, I've worked with, multiple children from the same household who've gone through what might be defined as a horrific event. And not all of them experienced that as a traumatic event. They all had different reactions, again, physiologically and psychologically to the event, such as a car accident. things like that. So I just wanted to share, right, again, it's that important reminder that we don't ever want to kind of overgeneralize or make assumptions about anyone's experience. And a couple reminders for us on what are we talking about with adversity, right? There's so many different types. And I have a few slides here that outline some of the major ones that I think the work that we do, that we observe. We certainly have examples of abuse and neglect. So we have physical, emotional, and or sexual abuse, as well as physical or emotional neglect. And then we're thinking about household stressors, right? Thinking about things like severe poverty, mental illness, a caregiver who's treated violently, an incarcerated relative, any military family-related stressors such as deployment, parental loss or injury. We also have abrupt or unexpected violent deaths of a loved one, forced separation from caregivers, divorce, and also substance abuse in the home. And then we're also thinking about the importance of societal and community experiences, right? Things like pervasive community violence, racial and xenophobic hate and bias, bullying and peer rejection, things like terrorism and war, and certainly other threats to physical safety such as natural disasters, accidents, or life-threatening illnesses. And I really wanted to center from our National Child Traumatic Stress Network and the National Equity Project, these three really important definitions that are centering systemic adversity. So we're gonna look at historical trauma, racial trauma, and systemic oppression, as well as impacting our young people, ourselves, and our colleagues, certainly. So the first definition here is historical trauma. And again, pulling from the National Equity Project, they define this as anything referring to cumulative emotional and psychological wounding as a result of group traumatic experiences that are really transmitted across generations within the community. There's a really great book that I have learned so much from as a white social worker and educator in this topic. That's called My Grandmother's Hands on Racialized Trauma and Being Able to Mend and Heal. So for what it's worth, I wanted to share that with all of you. And the next definition is racial trauma, referring to events that occur as a result of witnessing or experiencing racism, discrimination, or structural prejudice. And then lastly, systemic oppression, referring to the ways in which any given form of oppression or identity, be it race, gender, class, language, religion, right? How those can be holding people or groups back from achieving progress on things that are really important to them. So in this same context, we have another video. It's about 5 minutes long. That's really centering, again, systemic adversity. This video is coming from the University of Minnesota Extension, and this is about 5 years old, almost 6 years old, but this is something that we utilize a lot in the workshops that we do within our own organization, especially with the social work interns that we host each and every year. So we hope that this can be a really just kind of thought-provoking video, and we'll have a little bit of time for discussion afterwards. So again, my awesome co-host Danny is going to go ahead and pull this one up for us as we take a listen and take a look.
What matters in life is not what happens to you, but what you remember and how you remember it.
My dad said when they were growing up, they said, we used to play cowboys and Indians. And he started telling me this story. And we used to fight over, nobody wanted to be the Indian. And he said, I didn't think about that. We'd all play, and I'd always suck it up, and I'd be the Indian. But how ironic is it for a bunch of Indian children to be playing cowboys and Indians, and nobody wants to be the Indian? The introduction of a destruction of culture and loss of what is good. And I asked my dad, well, why didn't anybody want to be the Indian? And I thought I knew the answer. He said, because everybody knows the Indian dies. And that already in his generation, as strong as he was, he received a message as a young child. I received the same message, that it was not good to be Indian.
Slavery, colonization, forced relocation, and other historically traumatic events in generations past have lingering and profound consequences today. But what is historical trauma?
Historical trauma has to do with collective, cumulative emotional wounding over and across generations that results from massive cataclysmic events. The process that our communities talk a lot about is that the trauma is held personally and can be transmitted over generations. So even family members who have not had a direct experience of the trauma itself can feel the effects of that event generations later.
Does historical trauma only affect certain groups of people?
What really helps me to help people understand the notion of historical trauma is that it's actually a phenomenon that lots of communities, indigenous communities, or people all over the world have sort of struggled with. It's not something that specifically is only owned by tribal people or indigenous.
The empirical side started with work on the Holocaust survivors. And there's a lot of work on intergenerational transmission of trauma. And it's moved into also looking at Japanese internment survivors, Armenian survivors, descendants of their Holocaust, and so forth. So there's been some more empirical work in this area. And you can imagine trying to track trauma over generations and trying to tease out what is the impact over generations on this child, combined with whatever traumatic events they've gone through in their childhood.
Certain things. He never shared with us why he never cried, for example. He never shared with us why he walked out the door when my grandmother cried. Why he turned his back when she cried. Of course we thought he turned his back because he didn't care, of course. But he turned his back, as I look back now, because the pain has no words. I still have the images of him dealing with the limitations that he was up against. I can only imagine the pain. But what I do know is that it didn't go away. It came inside, into those of us who followed him.
No one ever talks about the moment you found out that you were white, or the moment you found out that you were black. That's a profound revelation. The minute you find that out, something happens. You have to renegotiate everything, and that's a profound psychological moment.
I saw a water fountain that said white in color. My family was 7 kids by then. We drank a lot of Kool-Aid. So colored water, that was in my cognitive schema. So I go toward this colored water fountain. And while I'm there, just before I get there, there's a little white girl who saw that same colored water fountain, and she was just about to turn the sprocket when her mother came and grabbed her by the arm. And she said, "You cannot drink from that colored water fountain." And she said, "But I want the colored water! I want the colored water! Oh, I want the colored water!" So I knew it must be good. So I run to the colored water fountain, looking for my mom, making sure she won't stop me from drinking. And I turned the water fountain, and it was clear, just like at home. That day, that trauma, I remember to this moment.
For African American communities, historical identity and understanding is inextricably tied to the reality of enslavement.
It ties us to enslavement with what an awful terror, 400 years of trauma we experienced. And for us, we talk about it as being utter cultural erasure.
Experienced historical trauma that are on this call. I just wanted to make sure that I was naming the importance as a social worker. And Fran is sharing here, oh my goodness, being the child of family members, and yesterday being the International Day of Remembrance for the Holocaust, right? There's just so many different things that impact us over generations, right? And think about those of us who are the first inhabitants of this land, our First Nations people, our indigenous people that continue to have to fight for their rights. just want to also center them as well, right, in these conversations. So yeah, Latonya, I'll definitely, I'll share the link, and the slides will be sent to everyone. Actually, the link will be in those slides, but absolutely. It's a great thing for us to also maybe share, who knows, with staff meeting, within staff and within training, right? That we're bringing that critical analysis to trauma, to this very topic, just like we're trying to do within education, and I think more within youth development. And Chantel, I think it was great because often she's sharing as a Black woman whose family and lineage is tied to slavery, right? It's overlooked how deep the generational trauma is and how long we've been and will continue to be affected. Absolutely. And right, just about, my goodness, is about just over 2 weeks ago yesterday, with the insurrection at the Capitol, right? Just thinking about the horrific symbols of hatred and racism and anti-Semitism that were on display that day, right? And that's another moment of pause and of trauma, right? Seeing that, that white supremacy that was just on full display that day. So wanting to just kind of name that today. And Fran, again, saying, as a child of Holocaust survivors, right, every part of who I am is the result of what my parents and family members experienced and how they survived to build new lives and to raise families with real values. Thank you for sharing that, Chantel and Fran. And Donovan, I saw your comment earlier about, right, that this is in our DNA. And so I think it's important for all of us as thought leaders to think about, how can we mitigate, right? Mitigate the effects of historical trauma or racial trauma in our work, within our roles. How can we be agents of change in that capacity, right? How are we able to, whether it's just acknowledge that this is real and share resources is one starting place, I think. Being able to talk to youth about their experiences of race and identity, be it discrimination on religion or sexual orientation, all of these different things combined can be really powerful. And I'm just going to write here also another resource on this very topic is Dr. Ken Hardy. He's an amazing Black family therapist and has written extensively on racial trauma. And has a great article, which is called Healing the Wounds of Racial Trauma, which is kind of geared towards social work, psychology, therapists. But I think all of us can have some really important aha moments when we read his work. And again, the book I mentioned earlier, if folks are interested, is My Grandmother's Hands, talking about healing from racialized trauma. So I just wanted to make mention of those resources. And again, I welcome thoughts around this. I'm going to go ahead and, just for a time, if it's okay, move forward, because we don't have as much time as I would like. I could probably be with you all day or a whole week on this topic, right? There's so much. I love this quote from Kazu Haga. Kazu Haga is an activist on the West Coast, does a lot of work in the Bay Area of California, and is the author of a really recent book called Healing Resistance, A Radically Different Response to Harm. And he shares this quote with us, that if we carry intergenerational trauma, and we do, then we also carry intergenerational wisdom. It is in our genes and it is in our DNA. I appreciate his naming of this. You know, we're talking about what Chantel has shared and Fran and their family lineage, right? And being survivors of such atrocities, such as the Holocaust and such as chattel slavery here in this country. And so I think it's just kind of a beautiful, kind of the flip of the coin there, right? That despite the suffering, that there's so much strength and survival and resilience that also lives within members of maybe we could say historically oppressed groups in this country. This is our last video, I believe. I think Danny might be back with us. I'll
yes,
double.
I'm
Awesome.
here.
Yay, so this video is a short clip from a longer TED Talk from the amazing Dr. Nadine Burke Harris, who has done a lot of research as a doctor. Yeah, Chantal, isn't it so great and everything? She's just amazing on how childhood trauma affects our health across a lifetime, and has authored a book. The Deepest Well is a great book also that could be utilized in a book club in your organization, thinking about how to heal the long-term impact of childhood trauma. So we just have a short clip. It's about 3 minutes long that we're going to go ahead and share with you now. And for folks who've already seen it, I apologize if it's a repeat, but my hope is that maybe you'll get something new from this clip that we're sharing.
It turns out this is exactly where the science comes in. We now understand better than we ever have before how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging. Children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed. So for me, this information threw my old training out the window, because when we understand the mechanism of a disease, when we know not only which pathways are disrupted, but how, then as doctors, it is our job to use this science for prevention and treatment. That's what we do. So in San Francisco, we created the Center for Youth Wellness to prevent, screen, and heal the impacts of ACEs and toxic stress. We started simply with routine screening of every one of our kids at their regular physical, because I know that if my patient has an ACE score of 4, she's 2.5 times as likely to develop hepatitis or COPD. She's 4.5 times as likely to become depressed, and she's 12 times as likely to attempt to take her own life as my patient with 0 ACEs. I know that when she's in my exam room. For our patients who do screen positive, we have a multidisciplinary treatment team that works to reduce the dose of adversity and treat symptoms.
Okay, great. So we're going to go ahead and just stop the video there. I know it's kind of a because there's so much great content that's being shared there. And again, Maybe Danny, in a few moments, if you wouldn't mind, maybe we could put all 3 of those links just in the chat box for folks who may want to go back and revisit or see them in full length. But the full TED Talk is about 17 minutes. Again, a really great resource for your teams, and her book, The Deepest Well, could be another, again, potential book club idea. So we're really thinking about, again, right, this impact of ACEs on health, right? And even thinking about, right, in adulthood, when we see increased markers for stress, such as diabetes, heart disease, that it can't be like whenever it's happening in a community, right, of folks who have been through traumatic events or perhaps come from a historically oppressed group, right? Again, what we're talking about, it's not a surprise, and we have to do better, right? We have to do better. So the prevalence that we know right now from our research is about more than 2/3 of children have reported experiencing at least one traumatic event by age 16. Some of these examples are sexual assault, things like cyberbullying, physical assault, witnessing violence. And in this particular study from 2015, there's a 20 to 25% percentage of youth from low-income backgrounds who have experienced 4 or more ACEs. Again, in their research, which we're seeing the connection between that and health impacts physically and mentally, which of course impact life and life trajectory, life outcomes. Many of us know a lot of how adverse childhood experiences can impact learning, right? And behavior and relationships. So this slide just gives us a little bit of a recap of a few of those common examples. Learning, delays in the development of language and communication skills. Also, it might hinder creative play. In behavior, we may see students who have difficulties with labeling and talking about their feelings in an appropriate way, difficulties with self-regulating their behavior, and sometimes we might see increased aggression and impulsivity in classrooms or in after-school programs. And then certainly, right, trauma and adverse events can impact relationship. Right, it can impact having or feeling safe enough to let the guard down, feeling safe enough to open up and talk and build even safe and secure relationships with others because of the past, right? Like Chantel was saying earlier, right? A lot of what we see in the present is really indicators of what young people have experienced before. So as a protective measure, I don't want to get too close to you because I'm not really sure I can trust you, or I've been hurt before. A lot of what we see are pain-based behaviors, right, in young people, and oftentimes also in the adults that we're working with, right, for so many of us. So thinking about these markers here, and also, as a social worker, I just want to name too the overdiagnosis and the misdiagnosis of things like attention deficit and hyperactivity disorder, or what's sometimes called ADHD. Thinking about how so many of our young people are often given this diagnosis when what's really going on is a trauma response. You know, they might present as having difficulty paying attention, difficulty sitting still, difficulty staying on task, quote unquote, and that can be mislabeled if that provider is not really careful to think about exploring some sort of a trauma history or providing like an ACEs analysis and meeting with that young person. And I love this slide. It's probably my favorite slide. Again, you'll get a copy of this, but early on, the ACEs were looking at, you know, maternal depression. Again, a few examples here: domestic violence, divorce, mental illness, incarceration. Again, certainly neglect and abuse. But what this slide shows us is kind of the pair of ACEs. And I love what's underneath of the tree. Adverse community environments is what they're labeling this. This is from 2017. And we have things like we talked about earlier with systemic adversity, things like poverty, discrimination, lack of opportunity, economic mobility, and social capital. violence, poor housing quality, and affordability. So I think this is a little bit more of a holistic picture when we're thinking about the pair of ACEs and really thinking about the roots of what's going on under the surface, right? Systemically, structurally, within the community that's also impacting on this young person. This is a much more holistic way, and I think a more humanizing way to look at the work that we do around trauma. And thinking about that we don't always get the full picture if we're just thinking about abuse, neglect, and issues within the household. So again, a really important consideration here is that having experienced any adverse event does not mean, again, necessarily that a child is having a traumatic response, okay? Or that they will experience poor life outcomes. Again, it's really about how that individual has experienced or perceived what they've gone through, potentially. But what's really awesome is this second point here, that positive experiences, positive relationships can serve as probably the #1 protective factor to mitigate those effects. So again, there's a lot of research now called PCE, positive childhood experience, and that's where we come in. That's where our staff comes in as buffers to really support, again, a more healthy trajectory for young people. And again, this is a really great practice to utilize with all students, even if we don't exactly know what they've gone through. I love this quote. This is actually from Christina Bethel, who's a researcher in positive childhood experiences. And she shares this with us, that every moment matters. Every interaction with a child has a reaction in that child. Even as we keep working to address the many social and cultural factors we need to address to prevent negative experiences, we should be focused on proactive promotion of the positive. In particular, there's a need to promote that through any door kind way of being, so that wherever a child goes, whether it's to school or wherever they're going, they're met with warm adults who purposely try to see and respond to them and meet their needs for care and guidance. I'm a firm believer that every child needs their person, that one person that gives them that unconditional positive regard and love, no matter the behavior, no matter how they're showing up that day in program or in school. So we're doing good. We're moving through now, kind of getting towards the latter part of our presentation. I wanted to share the Center for Disease Control's 6 guiding principles to trauma-informed approaches. Why I love this is that it can apply across setting, school, outpatient mental health program, after school program, you name it. But this approach gives us kind of 6 pillars to really, really focus on trying to, center and acknowledge in the work that we do. So it's not just like one particular technique or checklist. It really requires, again, this quote, constant attention, caring awareness, and sensitivity. And certainly, oftentimes, organizational focus and change. So we have these broken down a little bit with examples. I'm going to try to fly through this so we can get to a little bit more of Dr. Ginwright's work here. So the first is safety, right? Certainly that all classroom environments are really feeling as physically safe and psychologically safe as possible. Having ground rules, norms, or maybe even community agreements or covenants established with young people can be one way to try to work to ensure that. Having trustworthiness and transparency, right? No matter what's happening in the class or the program, that young people are being communicated about those changes can be really helpful and really increase a lot of trust, especially between adults and students. Certainly having peer support, that and mutual help are foundational for a sense of community and safety and hope in the classroom, right? And thinking about the acknowledgement of different identities amongst peers is really a crucial part of this trauma-informed approach. I think with that peer support, it goes beyond like, it's like I'm accountable to you as well, you know, to not, yeah, my teacher, but also to you as a student. There's a lot of power in that. We have our last 3 principles here. The 4th is collaboration and mutuality. So partnering on work, there's a lot of, you know, in this bucket, meaningful sharing of power in decision making. That's really, really huge, right? Bringing in the ideas and thoughts of students and having just open, thoughtful discussion and meaningful discussion. A lot of that collaboration. I often talk about the power of meaning co-collaboration, co-partnering, co-laboring, right? Sometimes the work is really hard, but that sense of like, I'm walking beside you, not in front of you or behind you, can be really powerful. And then next, empowerment, right? Voice and choice. We know this, how important it is that the voices of our young people are being amplified, are being centered, and are really included in the program choices that we're making. And then lastly, we're talking about cultural, historical, and gender issues in this approach, so that members of the school and the classroom strive to move past cultural stereotypes or preconceived notions, right? Mitigating that implicit bias, which we all carry, and promoting culturally responsive teaching and really celebrating and welcoming all students and all identities, right? That young people feel valued and visible, I think is really huge. So I hope that some of that can be further, you know, maybe helpful or discussed with your teams. Here it is again, the slide with the 6 components. We don't have time probably for a huge reflection at the moment, but of course, whatever you're thinking or feeling, feel free to list it there for us. But thinking about how are we already doing some of this may be helpful. Where are the gaps? What might we want to increase or, you know, or expand in this particular year ahead? Great. And now we're kind of getting back to where we started in discussion around hope and healing in urban education. And again, this phenomenal book that we see here by Dr. Sean Jin Wright, really centering his thoughts and ideas here. And this approach to trauma response requires a different question. Even then, you know, we've talked about, you know, not saying like, what's wrong with you, but like, what's happened to you? And then he pushes us even further to ask, what's right with you? What is going really well for you? This approach views that those who've been exposed to traumatic events are really agents in the creation of their own well-being rather than victims of traumatic events. So you might think about this kind of a social justice and strengths-based approach to trauma response. It's a very holistic approach. It's very asset-driven. And it really comes from this idea that people are not harmed in a vacuum, right? And that well-being really comes from participating in transforming the root cause of harm. And often that cause of harm is within institutions. So again, it's moving us beyond the one-on-one to more collective and group healing, and really truly like radical transformation within institutions such as schools or not-for-profits, things like that. I wanted to highlight just the 4 key elements of Dr. Sean Jin Wright's work. The first being that healing-centered engagement, or what we might call HCE for short. He writes is explicitly political rather than clinical. And again, just to back up for a moment, his work, his book here, and his approach is phenomenal because it can be applied to any setting. So not just for educators, a lot of the work that he did were with men who were formerly incarcerated and who were working, he was working within community-based organizations and did a lot of work with healing circles with these particular men. And he writes about that in his book out in California. It can be applied to the justice system. It can be applied to hospitals, you name it. So again, I just wanted to make sure I didn't leave that out. But the first tenet here is thinking about ways that in which policies and political decisions have harmed young people. That's what we're thinking about here with this political offering and invitation. So might a school policy around uniform, for example, be harming young people? Thinking about the policing of hair, for example, thinking about policies around after-school sports and what's required. So really kind of pushing us with that systemic lens. And then thinking about young people having that analysis of these practices and policies that maybe facilitated the trauma in the first place. So this is really inviting young people to examine what we might call a critical analysis of their harm, especially if it's happening, widespread in a community or within an organization. The next topic here, or key element, is that HCE is culturally grounded and views healing as the restoration of identity. Again, thinking about healing, as we know, is experienced collectively in so many different cultures. And so being able to really be aware of that and invite that into this framework. Thinking about the need for a healthy identity and a sense of belonging for young people, perhaps related to race, gender identity, sexual orientation, and then having discussions around how those identities all kind of intertwine with one another, which we could have a whole other workshop on intersectionality and that the importance of that concept as well. So again, especially for youth of color, that these forms of healing can be really rooted in culture and can really serve as an anchor to connect them to one another when they do have shared identities. Again, being historically grounded and also contemporarily relevant. And then the last two elements here we have on the left, that HCE, again, is really asset-driven. It focuses on well-being that we want, rather than symptoms that we want to suppress. So it's kind of a little bit of a shift in our language and thinking about, okay, what do I want for my life? Not like dwelling on what I've been through, but kind of using that as kind of a way to kind of a runway almost kind of into greater things as they kind of fly and take flight in their lives as young people. And so asking those questions, right? What do you want? When young people have gone through a lot of trauma, sometimes it's hard to think beyond the present moment, as many of us have experienced, right? They don't always have that future-oriented capacity because of everything, just kind of survival that day. So this approach is really asking us to support them in thinking about the future, thinking about what it is that they want and what they want their well-being to really look like. And then lastly, which I love, is that this approach really supports the adult providers, all of us, all of you, with our own healing. There's a real focus on attempting to support adults who also are healing forces with young people, kind of a healing the healers approach. So things like having maybe mindfulness meditation for staff, supporting them in healing circles as well, where they can just kind of come in and talk about how they're doing. Oftentimes, right, there's so much of us that we kind of give and give when we work with young people, but I'm a big believer, right, in that if our bucket's not full, how can we give to anyone else, right? Many of you all are resources to adults, to young people, to your funders, to so many, to parents. And within that word resource, right, is the word source. And that's us. So if we're not giving to self, then it's really hard to show up and to be a healing force to others. So I love that he really focuses on that piece. And I wanted to give us some time for breakout groups. I'm not sure that we have the time for that. So maybe we can just use the chat box if that's okay with the group. Since we are ending in about 12 minutes and we have the evaluation coming. But I would love to spend, a few minutes here together with all of you on what are your ideas around these frameworks? You know, are you already doing some of this work? And if so, how might you expand upon it? Or are you kind of excited to maybe think about bringing something new and fresh to the work that you do with young people? Or who might be able to support you in moving your plans forward, things like that. I'll share for our own organization a few years ago, we are a lead CBO in East New York, Brooklyn. And for Black History Month, a lot of our students were talking about like the stigma around mental health, the stereotypes if you have a counselor, stuff like that. And they decided to organize a panel of Black mental health professionals in Brooklyn and invited them to come to this beautiful panel that we held at the school, which is now unfortunately closed due to COVID. But this panel was one way that young people kind of brought their own drive and their own desires to kind of heal collectively by providing education and normalizing mental health as Black identifying students. So that was just one thing that was really beautiful for the community and for the school. And we're hoping to do that again, actually, next month within that community. So that's one example where healing, right, is for their own healing was like, we got to work harder on this and talk about that it's okay if you're not okay, if that makes sense. So that was one thing that is kind of fresh in my mind around this topic. But there's other thoughts or ideas. I know a lot of programs are already implementing HCE frameworks. I'd love to hear a little bit about what you all are doing. And Melissa, we have a space where students can speak with our after-school clinician individually for those who may not feel comfortable speaking on an issue in a group setting. And that this space is very inclusive of our special needs students, right? Because now more than ever, they need a safe space to speak on how they feel. That's beautiful. It's so nice to hear that there's an after-school clinician, it sounds like, that young people can talk to. Because sometimes, right, a lot of young people come to school or log into school now virtually because they have after school, right? Because they feel most connected to the adults in that after school program. So what an amazing thing to have a clinician there who can support and listen. And again, it doesn't have to be a social worker, you know, clinician, quote unquote, can be anyone who creates that open space and invites conversations. So this framework is not just for social work, but it's for all of us despite our different educational backgrounds and titles. That's great to hear. And Donovan, I think leaning more into the vein of helping students identify their strengths and playing to them. I love that, providing space for them to explore their strengths and apply them in a team setting. I love that, giving them language in hopes of strengthening their identity. Absolutely. Those are amazing, amazing kind of different avenues to lean into and kind of give some time and attention. I know for me, like the group work is always so powerful with adolescents because it's like kind of that collective power and the mutual aid, and everyone's kind of saying, yeah, well, you know what, I've been through that too. Or, you know, this is what I did whenever this happened between me and my mom, you know, or whatever it is. And there's just real power and kind of, as you're saying, like a team setting or a group setting, especially as we're thinking about healing and moving forward as collective groups of people. It's awesome. Great. So we're just going to kind of move forward. Please feel free to continue to share your thoughts. The author invites us to consider a couple different steps when we think about expansion. One of them being continuing to build empathy with young people who've experienced trauma. He invites us to think about kind of being more vulnerable as adults with young people, kind of this, what he calls an empathy exchange, where we don't want to like utilize that young person as our therapist or to like process our own stuff, right? But a little bit of use of self or a little bit of self-disclosure when it's appropriate and whenever it's really in service to that young person, sometimes can really build that relational traction, we call that in social work, where there's a little bit more of a deeper relationship that can happen with that vulnerability from us as well. But again, being very mindful that we're not oversharing or that we're not breaking down emotionally ever in front of that child, right? But maybe same thing, I've been through some things too, and I understand what you're experiencing, and here's a little bit of my story, and when it's appropriate, right? And also leaning on, your coworkers and thought partners in that respect. Certainly encouraging young people to dream and imagine, thinking about, right, creating opportunities for them to play, design, envision their lives. Freedom dreaming comes up for me in Bettina Love's book, We Want to Do More Than Survive, when she talks about abolitionist teaching and this pursuit for educational freedom, and being able to have those conversations to allow young people to reimagine and again, re-envision their future. And also building critical reflection and taking loving action are other invitations from this author. So thinking about healing and well-being are being fundamentally political, not just clinical. And then thinking about liberation practices in social work and also within education, where we're thinking about the individual, we're thinking about the community, the organization, and also society, in the interrelatedness of those different domains, if you will, and how they all impact people and groups of people. That's that critical analysis. Potential ideas here are training staff on things like anti-oppressive practice. Again, Dr. Ken Hardy's work there has been really helpful in my own work with interns and other social workers and educators. Thinking about what are culturally relevant and responsive interventions in schools. Training staff on self-care, self-preservation, certainly leaning into clinical and the school-wide context and those systemic issues. And lastly, promoting self-advocacy and collective loving action. So a couple examples that I have there of things that we've done in the past, which will also be in the slides that you receive, with things like, again, mental health campaigns and panels, students leading restorative circles, following tragic events in school communities for that collective healing to happen. And we've also created what we've called reflection rooms after traumatic events as well, where young people could kind of come in, listen to music, talk to a social worker. They wanted to sit in a circle, they could do that to process. They could create artwork or jewelry, or also kind of tag up what we call like a graffiti wall, which is just newsprint all over one wall of the room, as one way to again promote more of that collective healing, and then thinking about having conversations around the systemic issues and causes related to what was happening in those particular schools. Awesome. It's about 11:11. So what we're going to do now is, I'm going to stop talking for a second and allow Danny to drop our evaluation link in the chat box for all of you. If you could please take a few moments and fill that out, that would be amazing. And we also invite you to, again, if you can, reshare your name and your organization in the chat box as well. That way, just make sure everyone that was here is accounted for. So I'll just pause there for a moment. Again, the link is there in the chat box. Awesome. Thanks so much, everyone, for putting in your name again in your organization. And thank you for the evaluation. I know that was a lot of kind of rapid fire content and not as much time for breakout rooms within just such a short time frame, but my email is here if folks want to keep in touch. Please do so. I always love some email exchanges. And also, again, you will get the slide deck emailed out. And those video links as well will be a part of that email that you receive. So you can go ahead and review or rewatch those 3 videos, and you'll have the slide deck as well. So I just want to say thanks to everyone for, again, spending part of your Thursday with us over here at the leadership program. Thank you to Danny, my awesome co-host, in sharing those videos with the group. And if there's any other last comments or questions, we have about 2 minutes left. And if not, I just want to wish everyone hopefully a smooth end to your week and a lovely weekend ahead. Thank you so much.